That's the Good Things. I'm your host, Rebecca Turner. Now, don't forget, you can listen to Good Things. We are streaming live over at supertalk.fm. We're also streaming from that SuperTalk Mississippi app and your local SuperTalk Mississippi radio station. But don't forget, you can watch us too. We are on your computer, your mobile device. Just head on over to SuperTalk TV. Now, you know taking care of your physical health is a good thing, but what about your mental health? We want you to take care of that too. Joining us today is TrustCare's mental health provider, Tommy Howington, to tell us a little bit more. Welcome, Tommy.
Hey, thanks for having me.
It's good to have you here. We often talk here on Good Things about our physical health, but also to our mental health. But I love to see where more establishments are kind of recognizing that the two need to go hand in hand, at least under the same clinic. Oftentimes you have to go to separate places to kind of get that kind of care. So what happened in the TrustCare world that they recognized the benefit to that to bring you on board?
Yeah, so I had the meeting with the TrustCare leadership, and they expressed their interest in expanding and making their footprint in this this realm of healthcare. And from the initial meeting through the interview process, everything just kind of it just went so it felt perfect. So I'm excited to be coming on board and provide these services.
Mental health care isn't new. It's been around for a long time, but I do feel like we're slowly getting more access to it, or at least in different ways. Do you feel like bringing you on board there at TrustCare will increase access for people who may not otherwise have sought mental health care?
Absolutely. Access to care is, one of the kind of leading barriers to care in Mississippi. And Jackson has, you'd have to check this, but I think we're one of the few towns that has over 100,000 people that actually reside here. And by and large, most times when you see patients, they say, I'm so glad to be here. We had to wait X amount of weeks or months or however long it was. So with TrustCare, with me coming on board, we're going to be able to provide some pretty rapid availability for patients that are seeking that service.
I think someone's listening to Good Things, Tommy, shaking their head. I know in other clinic scenarios it can be weeks or months, unfortunately, and sometimes the follow-ups can't, which just shows that the need is there and that, hopefully we'll get more providers through the pipe eventually. But anytime you can streamline getting to a healthcare provider, I think is definitely a good thing. Now, the word mental health means a lot of things. That's a big umbrella, Tommy, and I know like TrustCare can't cover all physical health also. It kind of has its area where it excels. What kind of mental health will you be able, or healthcare be able to provide?
Oh, so as a psych nurse practitioner, I can provide services across the lifespan. I tell people I've treated patients 5 years old, 105 years old.
Really, 105? What do they have to be down about? You make it to 105, you should be eating Cheetos, drinking whiskey, staying up late, all the things.
Absolutely. So it's like you say, though, it's just a part of our overall well-being, our mental health. So diagnoses could include, but not limited to, depression, anxiety, ADHD, everything in between.
What, in that age range, I know you can sort of see it all, but how long have you been on board? I don't know if you just started yesterday. I won't say who you've seen.
This is my first week with TrustCare.
Okay.
So I haven't treated a patient yet.
I want to ask your track record. That is excellent at the moment.
It's excellent, 100%.
Okay, so this is new. Okay, so how will the appointments look? Will it be virtual? Will it be in person? Will it be a combination? Or how will you guys be able to provide that care?
Combination. It kind of, we're kind of coming at this from a way of trying to make it as most convenient as possible. So I will be in clinic treating patients. There's also going to be the telehealth option that's available as well. So if it's raining and you don't want to get out of your house, but you don't want to miss the appointment, that telehealth option will be there.
For folks listening that are like, there's still some stigma around seeing a mental health provider or maybe encouraging their loved one to seek that out, do you think that having one so accessible will take some of the scaries away? I mean, they already trust TrustCare with their other care. It's not a new facility. Are you hoping that will encourage folks to maybe come to a familiar place but get a new form of care? Yes.
So that's a great point that you bring up, because there's such a social stigma with mental health. It's okay to go talk to your primary doctor about hypertension or diabetes, or anything in between. But don't go tell somebody that you feel bad. What is it? The two most common phrases that are the hardest to say are "I need help" and "I'm sorry." So we're always trying to shake that social stigma that's associated with mental health.
You mentioned some words that I feel like are trendy now when it comes to mental health: depression, anxiety, these type of things. How do you help folks kind of unpack whether that's the roads that they're on versus just maybe having a rough patch?
Well, that kind of comes out in your evaluation. So, most people don't want to just come right in and sit down and start talking about their problems. So, that's kind of your approach as a provider, of sitting down and really interviewing your patient completely, kind of find out what's going on, how long have the symptoms been there, was there anything that maybe caused these symptoms, was there a life stressor or an event that you can think back to in the recent past that really kind of started these things. So it's really kind of peeling the onion to see what are we working with.
And I would assume, too, that you don't push to get into background or history unless the patient opens up for it. I know that's been a big roadblocker for a lot of folks. They don't need to be in my business. Well, it's your business. You get the opportunity of how much you share or you sort of don't share. I feel like is always a big block, too, for individuals. And then there's this idea, Tommy, well, they're like, other types of doctors. If you go once, they're going to tell me I need to see them once a week for the rest of my life to be emotionally stable. Is that true?
Well, so for a patient that I'm treating, if I'm starting a medication, which, sometimes there are appointments where maybe the patient's not on board with starting a medication. Well, that's fine. That's, I'm completely on board with that. I'm not going to hold your feet to the fire and say, you have to start this medication or you can't see me again. Well, let's schedule a follow-up appointment in a month. Let's see how things are going. If it gets to that point, these would be the options. These would be the recommendations that I would have today. And after being with TrustCare now for 5 days, the EHR that we work with is really convenient. Patients are able to reach out and message their provider and kind of hear back through the platform. So that makes it convenient too.
Well, I'm excited. I'm excited as someone who's in sort of preventive medicine and just sort of understanding, treating someone as a whole, that you can get this opportunity under one roof. I know that's a big barrier for a lot of people. Just obviously just change of place sometimes keeps people from going. So having all of their, cooks in one kitchen, so to speak, can be very, very helpful. If people, have questions, can they call and just ask what some of the services are or what things that you provide before setting up an appointment, or do they have to be referred to you, Tommy?
So there's not going to be a referral that's necessary. I believe there's a website that's going to be created where I think they're going to be able to read a little bit more about my background specifically. But if anybody has any questions, I would certainly tell them to call us at TrustCare. I'll be at the Lake Harbor location, but I believe if you contacted that front staff that they would be able to get the phone call and get any questions that somebody was seeking answered.
What would be the main red flags that you would tell someone seek help for? You don't have to live that way in terms of mental health. You don't have to, that's just not you. You don't have to just deal with that.
Well, that's a really broad question, but it's really just about how bad or how impactful your symptoms are. If and the people around you are going to know you more than I do. And if people around you are noticing that you're more isolated, you're more withdrawn, you're not really getting that enjoyment out of things that used to bring you joy, like if that describes some of the things that you're experiencing, come in and let's talk. That's my pitch. I'm not saying come in and let me put you on medicine. Come in and let's talk.
And that would be, again, from ages 0 to 105.
Absolutely.
I want every 105-year-old just to be super happy. I want whatever it takes for you to be cheerful at 105. We need to make that happen.
Right.
But as well as 5 and sort of beyond. So I'm excited for you, Tommy. I'm excited that TrustCare is sort of taking this on. I hope that it expands to other locations. I think it's an important piece to our healthcare puzzle, and I'd like to see that grow. So I appreciate your time. And one more time, if people want to get an appointment with you, How do they do that?
So you can either contact the TrustCare at the Lake Harbor location, or you can log on to the TrustCare website.
All righty. I appreciate you. You guys stick with us. We got more good for you coming up next.